This is a great question. I want to answer it, and excuse this. I just got back from the gym, and my daughter's watching YouTube right now in the background because their house is getting cleaned. So sorry if you hear like little kid videos, but great question. If your patient self-extubates, what do you do? The first thing I do is get help. So I would usually call my respiratory therapist in the room, so that way I have someone at least coming into the room to help me. The next step depends on how your patient's actually doing. So I heard a study, and I don't know the exact study, but that most patients that self-extubate actually are doing well enough to where you may not need to immediately intubate them again. But if your patient's not breathing well, then the next thing I would do is turn off all sedation meds that are inhibiting their respiratory drive. Then I would make sure that I secure their airway or provide them with whatever oxygen source they need for that patient. Some patients may just need a nasal cannula if they were close to being extubated. Some patients, you may have to manually bag them if they are not breathing well. So make sure your airway is secure and bag them if they are not adequately breathing for themselves. At this point, hopefully you already have help in the room, but I'd also notify the provider. I'd probably have another nurse or somebody do that, just to kind of give them a heads up that, hey, they self-extubated. And if your patient's not doing well, you'll know pretty quickly if they need to be re-intubated. So at this point, I would have everybody else kind of setting up to re-intubate the patient, getting your intubation supplies, your RSI kit to intubate the patient, probably some better restraints if they are self-extubated already. I've had, I think, 2 patients self-extubate in my career, and both of them were ready to be extubated. It was like we were waking them up to extubate themselves, but that's not always the case. But always make sure that your patients are appropriately restrained. Never keep, the suction that you use in your ET tube that people, you suction the patient and they bring it down here. Make sure you pull that out of the way because patients can grab that and pull on that. Use double restraints if you need, use mitts if you need, and obviously appropriate sedation for your patient. Okay, I think that's it. If you have any more questions, let me know. And yeah, hope that was helpful.